2 methods for treating insomnia. Many elderly people suffer from insomnia or wake up naturally before dawn and can't fall back asleep. Elderly insomnia is not only related to physical weakness but also to certain lifestyle habits. Irregular daily routines are especially likely to cause insomnia in the elderly. Here, I will introduce 2 remedies to help the elderly improve their sleep and enhance their overall health. Napping incorrectly during the day leads to nighttime insomnia. Start by changing your lifestyle habits. In traditional Chinese medicine, insomnia is known as bu mei, lack of sleep, bu de mian, inability to sleep, bu de wo, inability to lie down, or mu bu ming, eyes not closing. The severity of insomnia varies in traditional Chinese medicine diagnoses. Milder cases may involve difficulty falling asleep, shallow sleep, waking easily, difficulty falling back asleep after waking, or fragmented sleep, while severe cases may involve being unable to sleep the entire night. To address insomnia among the elderly, it's recommended to first change lifestyle habits. For example, avoid eating stimulating foods at dinner, limit naps to no more than 30 minutes during the day, avoid drinking coffee within 8 hours before bedtime, and avoid going to bed too early. Taking brisk walks 5 times a week for 30 minutes each time can also help restore normal sleep quality. Yin deficiency and yang hyperactivity can cause insomnia. Stubborn insomnia requires long-term treatment drive. Wu Mingzhu, a Chinese medicine practitioner, emphasizes that most insomnia is caused by yin deficiency and yang hyperactivity, often seen in conditions such as mental exhaustion, mania, depression, and other brain disorders. The treatment should focus on nourishing the heart's yin and calming the mind. In treatment, it's advisable to nourish the kidneys, reduce heart fire, and harmonize the heart and kidneys. Medications such as banxia, pinelia, and shakusao, prunella vulgaris, can be used in combination. Patients who visit clinics for insomnia have often been taking Western medication for a long time but still cannot sleep. This stubborn type of insomnia is usually accompanied by phlegm heat issues, which can manifest as a bitter taste in the mouth, dry mouth, and constipation. Treatment should focus on removing phlegm and clearing heat. 3 tips for a good night's sleep. Sleep regularly. Develop the habit of going to bed and waking up at the same time every day. Even if you can't fall asleep, lie down quietly in bed. Aside from a midday nap, avoid sleeping during other times of the day. Nap during the Zi-Wu hours. Try to sleep during the 2-hour periods around midnight and noon. Soak your feet before bed. Soak your feet in warm water before going to bed. 2 herbal recipes to improve sleep. Lily and lotus seed soup. Use 11 grams of lily bulbs, 7 grams of lotus seeds, and 5.5 grams of white fungus. Add an appropriate amount of water and stew the ingredients. You can add a small amount of rock sugar for taste. Both dried medicinal lily bulbs or fresh ones can be used. This recipe helps moisturize the lungs, calm the mind, and nourish the skin. It is also effective for chronic cough, emotional disorders, and irritability during menopause. Licorice, wheat, and red date flour tea. Prepare 4 red dates, 5.5 grams of licorice, 11 grams of floating wheat, 5.5 grams of rose flowers, 5.5 grams of salvia root, and 11 grams of lily bulbs. Clean the ingredients and place them in a cup. Then pour 500 milliliters of warm water over the herbs and let them steep before drinking. This medicinal tea helps calm the mind, relieve depression, stabilize emotions, and promote sleep. Elderly individuals should maintain regular and healthy lifestyle habits to effectively prevent insomnia. Kidney deficiency and irritability can also affect sleep quality. It is recommended that the elderly consume the 2 herbal recipes mentioned above to nourish the kidneys and enhance overall well-being, thereby improving sleep quality. At the same time, maintaining a calm and relaxed mood is essential to avoid anxiety and stress, which can negatively affect sleep quality.